I'd like to convince you this collection isn't just about illnesses, and there's actually a large scope of topics covered. This first fun fact I've taken from one of the minute books of 1962. It was planned for when the M6 opened in December that year. These records aren't just pages and pages of correspondence between the officers and inspectors. There are publications, brochures, and leaflets about all sorts of projects. Here's an image of the smallpox hospital for South Staffordshire. This image from a sewage works with its new pumping station didn't have a good enough caption. I thought maybe just, well. I think this was a great idea in 1892. There was a competition for the design of the asylum, with the best design winning the contract. A member of the asylum committee commented there were a lot of good designs submitted, and he actually struggled to pick one above the rest. This national epidemic affected Staffordshire from 1900 to 1902. The records cover the council's process of beer sampling and returns from every district notifying of any potential cases. The worst hit area was Lichfield, which had over half the whole county's reported cases. The source of the problem was traced to glucose in the beer, which was supplied by a company in Liverpool. All of these facts came from our medical officers of health records. I could talk forever about the contents, but I'm going to be kind to you and give you just a brief outline of the collection's expected and unexpected topics. This is probably the most predictable topic in these records. There are over 40 different illnesses mentioned, from the expected measles and typhoid to the unexpected ringworm and miner's worm disease. The records also include the work and sometimes questionable practice of midwives, the development and running of the healthcare system, and stuff related to mental health, like the provision of daycare centres for children and adults. Pollution may not have been the most obvious topic. In the earlier records, a large amount of the content focuses on river pollution. At a time where many sewage works and systems were being built, there were lots of complaints from local residents and businesses because their essential water supply was often polluted and contaminated. Sanitation is a very broad topic and covers subjects such as these. The two main areas really are sewage and water supply to independent houses, villages and towns. Typical entries also include projects such as the disposal of rubbish and the replacement of privies with WCs. Housing was a topic I didn't expect to see. There are a considerable number of notifications of overcrowded properties where up to 14 people shared 2 bedrooms. Conditions like these led to poor sanitary conditions and were a concern for the council because disease could spread very quickly. Council housing related records appear after the Housing of Working Class Act in 1890, and applications for housing development grants after 1929 are also included. Education was another topic I didn't expect to see. There are notifications for school closures due to infectious diseases and poor attendance. The attendance wasn't helped with the scheme to suspend siblings of ill children to prevent the disease from spreading. School medical officers were allowed to attend to the students, and there's correspondence with the county medical officer about the children's health. Records about the war do give us an insight of the conditions away from the front line. For World War I, there are records of the billeting of troops, soldiers returning on ships which had cases of smallpox, and local development schemes being put on hold as the builders went to war. As for World War II, subjects include the possible evacuees from Liverpool, nurses from the continent who wanted to practice, and the implementation of air raid measures. I know this topic is a bit of a cop-out, but there really are subjects which don't fit in with any of the other topics. These include anti-smoking laws, scientific developments, objections to the extensions of boroughs, including Wolverhampton in 1926, and doctors opposing the NHS in the 1940s due to changes to their contracts and wages. In this presentation, I've shown you just some of the incredible scope of the records. If you don't take anything else away, please remember that the medical officer's records are about more than just illnesses. Hopefully you'll be inspired to explore and share some of the great stories in this wonderful collection.